As we all know, healthcare market is a very complicated system. Telehealth describes a quickly developing technology that allows patients to receive medical care through their digital devices. Instead of waiting for face-to-face appointments with their doctor with oversubscribed services, telehealth gives patients different access points to healthcare when and where they need it. It is particularly useful for patients managing chronic conditions as it provides them with consistent, convenient, and cost-effective care. In this video, I'm going to introduce a new arrangement of care delivery with the existence of a virtual technology which is combined and developed by Catholic Health Initiatives. CHI has created a new infrastructure for the delivery of healthcare that shifts the central focus from the acute care hospital to outpatient facilities and the home. The healthcare delivery infrastructure is being replaced, at least conceptually, by new structures that revolve around physicians and other primary care service providers having more direct responsibility for patient care, says Juan Serrano, Senior Vice President of Payer Strategy and Operations at CHI. CHI has expanded its relationships with physicians and has acquired other ambulatory organizations, including a home care services organization, to offer more outpatient care, focusing on outpatient care and care closer to home signals as a shift from only treating sick patients to preventing sickness and maintaining people's health in addition to treating sick patients. The virtually integrated care model was envisioned by clinical leadership to begin to address those questions. We imagined creating a model that recognizes challenges with ongoing nursing personnel shortages by re-engineering each staff member's workflow so that the most appropriate care team member is completing the defined responsibilities. Our thought was to develop a prototype model that recognized the value in using technology for both patient interactions and business strategies now and in the future. This vision complemented dynamic, real-time quality and patient safety surveillance practices, which prioritizing CHI's innovation goals. In 2014, the National Virtually Integrated Care Design Team charted a one-year 10-bed prototype phase in order to develop the clinical and technical architecture framework for the new model. The design team included both national and pilot site nurse leaders, a project manager, staff nurses, providers, and ancillary staff. The model leveraged the integration of advanced communication technologies with the new role of a virtual advanced nurse care. The design team has 6 guiding principles to frame their clinical design architecture. First, provides increased caregiver availability via a new virtual nurse role on an adult medical surgical unit. 2. Does not compromise safe, high-quality care. 3. Enables real-time quality surveillance practices. 4. Establishes a collaborative relationship with the patient and their families. 5. Facilitates coordinated interactions with members of the intercollaborative care team. 6. Is cost-efficient due to streamlining of traditional acute care, unit-based caregiver roles and responsibilities so that appropriate skill levels are utilized to provide for patient needs. The new integrated model of care was formally named and trademarked following input from frontline staff during the prototype phase. The new model inserts the patient at the center of its care. It combines advances in technology with a restructure of primary caregiver roles, allowing each caregiver to practice at the full extent of her education and training. The new care team included 1 virtual nurse caring for up to 20 patients. She or he works with a team consisting of 1 RN, 1 licensed practical nurse or paramedic, and 1 certified nurse assistant who care for a team of 10 to 12 patients. The virtual nurse provides leadership and oversight to the patient care teams and facilitates patient-specific continuum of care planning. From a virtual command center located in the pilot facilities, the virtual nurse has access to the patient's electronic health records, integrated clinical decision support tools, and video conferencing capabilities for interacting with the patient and family. This immediate access to pertinent clinical decisions tools makes it easier to develop and coordinate individual care plans, provide education and information to the patient and family, and prepare the patient for discharge. The technology enables the patients and family to connect with the virtual nurse to ask questions and seek counsel about their care. The virtual nurse is also available to the bedside care team members for consult and support with clinical decisions. This included availability to round with physicians. Privacy concerns are always paramount. Sessions are never recorded and patient permission is requested prior to communicating with patients and/or their families. One of the first challenges faced stem from a lack of connectivity. There are areas where you get into the mountain regions where they don't have good cell phone coverage or broadband coverage into their communities. It's a real barrier when you're trying to do things virtually and get healthcare into those communities and populations. It's one of the biggest challenges that we have to manage until we can work with the government on broadband expansion. Besides, being able to deliver a full site of medical services with connected devices from remote sites require a sophisticated support infrastructure. Behind the scenes of a telehealth instance, there is an impressive area of sophisticated technology. The challenges presented by poor connectivity when it comes to running telehealth system. To be really effective and enable providers to augment care, issues of latency must be addressed before launching a telehealth program. A doctor can't actually diagnose a condition if the image feed freezes or if lab data can't be shared or retrieved. As organizations like CHI continue to improve the quality of care they are able to provide through their telehealth services, it will be vital that they maintain the infrastructure that enables their doctors and nurses to treat patients remotely. With a resilient and adaptable data management infrastructure in place, doctors will be able to care for patients in virtually the same way whether they are in the office or in their home. We believe that one day, telehealth will be fully combined with the new arrangement of healthcare delivery and widely spread worldwide.